Hope Channel, changing lives.
Good evening. How can life be meaningful if you are not healthy? Your health really matters to you, your family, and the nation as well, because your contribution will imply the fact that you are going to move higher, help your family, help Mother Ghana as well, and any other part of the country you find yourself. On this note, I welcome you to Healthy Living. My name is Nana Akusiabuache. Let's go for a quick break. We'll be right back.
Hello, my name is Mrs. Betty Adom, a career woman, a wife, a mother, and a servant of God who is passionate about families. Do you know that quality life is all about finding happy balance between friends, work, worship, and family? Family is very crucial when it comes to happiness. That is why I bring to you a talk show that is more involving, informing, and thought-provoking from the Christian perspective to assist 21st century families in handling issues confronting them. Join me every Friday, 8 p.m. on this channel with experts to strengthen families and to inspire hope.
Hope Channel, changing lives.
My name is Patricia. I am a backslider and nothing moves me to go to church. I can't remember the last time I read my Bible or prayed. My question is, how do I get back to my spiritual faith again? Will God forgive me?
Hello, my friend. I read your messages and I see your loneliness, struggles. It is tough for you right now. But I have a tougher God who is ready to journey with you.
Hi, Hope TV. My name is Charles, and I'm a student. I am having challenges concentrating in school and focusing on my studies.
Are you troubled? Are you overwhelmed with life issues? He says in his word in Isaiah chapter 41 verse 10, "Fear not, for I am your God." Send your request to hopetvghana@gmail.com. And our WhatsApp messages and text messages you can send to 055-968-0066. And at our social media handles at HopeTVGH. Tune in this Tuesday and Thursdays at 8 p.m. and we will pray together. God, our God, is a prayer answering God. God richly bless you.
Hope Channel, changing lives.
Welcome back from the break. If you just joined me, this is Healthy Living with me, Nana Akusiabuache. And today I have with me wonderful couples. Yes, it's a surprise one. We always have single doctors, but today we have two great doctors in our midst. And I have with me here Mr. Dr. John Ham. You're welcome.
Thank
and
you.
then his wife, Mrs. Mary Penelope Ham, who is a doctor and a gynecologist, of course. I love that one. You're welcome.
Thank you.
All right. Today we are discussing the topic uterine fibroid. You know, for some time now, I don't know if you've taken notice of the fact that growing up, there were some illnesses that wouldn't actually get to younger girls, because you're talking about fibroid, so I'll use women. Yes, girls hardly get fibroid, but I don't know if you've noticed this. Younger girls, even as young as 14 years, suffering from fibroid, and it's very, very disheartening. So today we are going to discuss the topic uterine fibroid, and I think you don't want to miss this one. There's a lot to learn today. All right, I'll start from my mother, Mrs. Penelope, who is a gynecologist. Before we go to uterine fibroid, what is fibroid actually?
Fibroid is a benign tumor that grows within or without the womb, that is the uterus. And it is always round in shape.
Okay.
Yes. We have different types of them. It is a fibrous tissue that grows in that form. And so that is the name, fibroid. Yeah.
All right, so who can actually write fibroid, or who is likely to get fibroid?
I will say that all women, depending on your health status.
It's because I'm asking that because of the experiences from younger
Exactly.
kids. Yes, that we are experiencing now.
That is what I'm saying. It is depending on your health status. Some women are prone to it. Some are genetic. And the age that we normally detect this problem is around 18, 20 years.
Okay.
Yes.
All right. Daddy, so what are the symptoms if somebody has a fibroid? What are some of the symptoms you see?
Thank you. Most of the time, fibroid doesn't really show up symptoms. You hardly, about half of the female or women, you hardly see symptoms with them. Except that probably you're having some routine pelvic examination. Then of course some of these things will be detected.
Okay.
But mostly the symptoms of it would have to depend on, sometimes you see some ladies bleeding in between their menses.
Yeah, that's
is one of the signs that that will call for probably seeing your gynae or any GP to be able to screen with maybe ultrasound scan, pelvic scan, of course, to be able to detect. So bleeding in between menses is one of the symptoms we got to be looking out for.
Okay.
Then secondly, you could also have painful menstruation.
Yes, that is where my worry is.
It is an issue that should get you concerned.
Is it always like that?
It is not normal for a woman going through menses and then going through pains. The only pains detected during the menstrual cycle would have to do with probably during ovulation period, which the movement of the egg lasts just for 24 hours and it's gone. So anything that is coming in at that particular time where a woman has to go through painful menstruation, then of course it calls for a worried or medical examination.
Okay.
You know, some women also would go through painful coitus activities, that is during sexual intercourse. They feel pains, which is also abnormal. Which, if you are a lady going through such a condition, it calls for an examination.
Okay.
So we can be able to detect what actually the problem is. But they are not normal.
Yeah, I'm asking that, I'm hitting on that side because we have a couple of friends whom have been through this thing. Some have this painful abdominal pain their first and second day. They've gone for the scan and all that, but they are being told it's nothing. There's nothing wrong with them. Yes,
it's not the fact that you might be having a painful menstruation actually indicates automatically that you might be having some myoma within the uterus. There are a lot of other factors that could contribute to that situation of a painful menstruation. But it is a call, a wake-up call for you as a lady to be concerned and then try to sort of do a routine checkup.
Okay, so while you were talking, you made mention that there are other things that can cause. So are there other issues that can also cause the symptoms women see?
Yes, painful menstruation is not, as I said, it's not only caused by fibroid. But then, for instance, if you're having some kind of abnormality within your cycle, situations of that sort can also develop, right? Let's say you have also had a very bad lifestyle. It can also lead to situation gynecologically with a painful menstruation. Excessive sugary intake in women have also been detected that situations like that could also develop with a very painful menstruation. And so there are a series of issues that are associated with a painful menstruation.
That precisely is not fibroid.
It could be. You could go through the a pelvic examination and it could be detected that it's not a fibroid. It could also be that you might have developed some ovarian cyst. That can also cause that kind of a painful menstruation also as well. So gynecologically, you needed to be sort of screened. And so the right diagnosis can be made. And then you get a right treatment.
All right. Dr. Penelope, so if someone has fibroid, what things can harm such a person? If I have fibroid, what other things will I go through?
Okay, so when a fibroid is a hormonal problem, it is a surge in estrogen that really causes the problem. And so if you're having fibroids, there are things that you have to abstain from, especially excessive intake of meat. And as he said, sugary stuffs. You don't exercise, and you eat anyhow. Your food.
You don't have to exercise.
No, you have to exercise. A lot of us don't exercise, and we put on, weight. Exactly. So we need to exercise, and we need to have good, healthy meals. Yeah. If you are able to take all these things out, it helps. As I said, it's a hormonal problem. And as a hormonal problem, women, we have two major hormones that play a role in our reproductive system. And estrogen, as I said, is the main causative factor of the growth of fibroid. So if that is the case, then some drugs that we also take, we have to be careful of them, especially these contraceptives and stuff like that. We don't have to abuse them, because a lot of these young girls abuse them. When I have 10 women in my office that I scan, at least 4 out of the 10 will have fibroid. And it is something that is on the increase. And we need to relay these informations out, so that, because before then, this was not rampant like that. But now you can see that our eating habits is not the best. The combination of our foods is not the best. And this problem is rampant with African women more than the other races are there. And so when you look at their meals, you can see that there is great difference how we eat our meals and how they eat their meals. And also our emotional, states also play a very great role. Women, we keep a lot of things inside. And when that happens, we cause a lot of problem in the hormonal system.
Okay.
When things happen, we have to let go and move on, because when we bottle everything inside, we kill ourselves, distort the hormonal system, and these things can happen.
All right, before I move on to other more questions, if supposing someone is going through the menstrual cycle, and supposing she's 6 days, and then ends up coming 4 days, the next come 5, the next come 4. I heard that it piles up, and then this can also create a fibroid if she don't go through the normal days she's supposed to go through. If she's 6 days and she doesn't fully cover up the 6 days and she go 4, meaning there's a chance she might get fibroid in future. How true is this?
Okay, so there is nothing like pilation of blood in the uterus. When you take fibroids, we have 4 types. We have the intramural, that is in the muscle of the uterus. And we have the subserosal, that is in the serosa lining of the uterus, that is, it goes outside. It pushes the perimetrum of the uterus out. And then we have the submucosal, that also grows in the mucosal lining of the endometrium. And endometrium is the inside of the womb. Good. And this type is very, very dangerous because it presses inside the uterus. And
I want you to repeat again. Yes. So our viewers will get this properly.
Yes. Because the subserosa, submucosa.
So meaning the rest of the 3 is not that dangerous.
They are all dangerous. But this one is the type that causes a lot of bleeding. Because it distorts the lining of the endometrium. So it makes the endometrium unstable. So anything that goes in there, you have a lot of clots when you're having your menses, and the bleeding is so heavy.
So that's where the clots comes in.
Exactly. And we have the pedunculated ones. They grow on a stalk. Now it's like you see the cloak.
The cloak.
Exactly. That is how it is. And this one grows outside the uterus and also inside.
So both
the
sides.
uterus, yes, so both sides. Some people will tell you, I'm having some movement.
Yes, they feel the movement.
Exactly, they feel some movement.
Like the baby.
Exactly. Like you mentioning babies. Some women will come and they will say, it is a baby.
I'm pregnant.
Yes, I'm pregnant. And they'll be taking all the medications for pregnancy.
Because their tummy bloats up a bit.
Exactly. And when you scan, they tell you, no, it's a baby. And so it becomes a controversy. So we have this type. And the one that really, really causes problem is the submucosa one. That causes a lot of bleeding. In the womb.
In the womb.
Yeah. So there is nothing like blood accumulation. The only point that I would like to stress on with that is if the fibroid is at the cervix, it blocks the cervix where blood is supposed to flow out. Good. That one we will have issues. So sometimes the intramural ones, they grow at the sides of the uterus in the muscle, and they push the cervix and close it. That one, all the blood will not flow out. So you have some clots remaining in there. And it is not that develops into fibroid. No.
Please listen to what Dr. is saying. That is not what causes fibroid.
No.
Okay. So meaning it's something else.
It is something else. It is something else. If you have blood in your uterus, it is different from fibroid. Yeah.
So what are some of the consequences when you have fibroid?
There are a lot. Numerous. Some of them is you become anemic because of the heavy bleeding, and also childbirth. We have some challenges in that. It is not always the fact. It is not always that if you have fibroid, you can give birth. You can have a lot of fibroids, especially the nodular ones. There can be plenty in the womb. and yet you can give birth. So, and some of them also cause, infertility. So infertility is also a part of it. You become anemic. Sometimes it grows so big that you passes urine frequently because it sits on the bladder, your urinary bladder. It sits on it. Some can be so huge. They can be so huge they can push all the abdominal organs up. The liver, the stomach, everything can go up. You can't breathe. I remember a lady came to
Dr. Penelope.
Yeah.
I like this point, and I think our viewers like it. But let's go for a quick break. Let's go for a quick break. We'll be right back.
You might be often hunted by the thought that success cometh by hard work. You have to put all your effort at your goal. Indeed, it is true, but stressing yourself too much may end up being fed up with your career or profession. As work is important for your survival, so is rest for a peaceful mind. Take a break and see the enthusiasm and refreshment you get. Join me, Pastor Ezekiel Oseasamwa, as we take a break every Friday, 6 p.m. only on Hope Channel. God bless you.
It's funny how guys always say they cannot understand women.
Really? You think it's funny? Women are so complicated. Sometimes I feel like we need special dictionaries just to understand them.
I need that perfect man to marry me then.
Okay, but are you perfect? In fact, so what's your definition of perfection?
So many issues, so many questions. Can we ever understand and get to know each other better? Life can be pretty confusing, but it can be simple too. What is your opinion on everyday life, ranging from love, marriage, career, money, and many more? Join me, Evie, this and every Wednesday at 8 p.m. right here on Hope Channel as we break down the realities of life.
Hope Channel, changing lives.
Welcome back from the break. Today we are discussing an interesting topic, that's fibroid, that is really worrying women of today. Dr. Penelope, you were making a comment.
Yes, as I said, I remember a lady came to the office and she was having a fibroid as huge as a 9-month-old baby. And she was bleeding profusely and you could see that she couldn't breathe. So I told her that this fibroid, we have to remove it. She said no. The reason being that she was afraid that if we remove it, she will die. There is this
deception
about it that when you remove it, you will die. So no matter the size of it, we would like to keep it. And it will be killing us, causing a lot of problems for us. So it's an issue. It can really, really go big and cause problem for us.
For us. So these are some of the consequences of when you have fibroid. It will happen to you. So please, if you have fibroid, that perception of you losing your life after surgery is totally wrong. You shouldn't have that. Is fibroid conscious? Like someone say that fibroid can generate into cancer. Is it possible?
Yes.
Let me ask Dr. John this.
It is not in all cases, and the truth of the matter is it's a benign tumor.
Okay.
And it's not malignant. And so it is not specifically to generate into any form of cancer. And so the notion out there that if you have a fibroid, it could generate to cancer, it's not the issue. But then the fibroid tumors can also sort of degenerate the uterus. And they can cause too much disturbances within the lining of the uterus, where the uterus possibly, the lining can develop metamorphosisly to, you know, a situation that looks like a cancer. But the fibroid itself is a benign. It's never a cancerous.
Cancerous.
Yes, as he was saying, most of them are harmless. They are not harmful at all. But some can degenerate to an extent that they become cancerous. Yeah, it is rare. It is not that common. But it is there that when it degenerates, it can become cancerous. That needs total removal of the womb and the tumor. Sometimes it even goes to the extent of removing the cervix and, you know, the fallopian tubes and everything from that place, so that you can be safe from that problem. That is why I'm saying that mostly when women are having the troublesome ones, if you advise them to take them off, it becomes a challenge. But I want to say that that fear that was there, that perception that when you go through either myomectomy or hysterectomy, you become, some say you become barren, you will not give birth.
That you wouldn't get back to your
because of that perception, a lot of women are keeping their harmful fibroids and they are going through hell. It is best you remove it. Normally what happens is when they remove it, you have scar tissues. Okay, so if your gynae helps you through it to heal those scar tissues, you can become pregnant. So if it is huge and it is disturbing, I entreat all women who are out there having this problem to just comfortably walk to your gynae and tell him or her, this is my problem. And if the person suggests surgery, you go through it. You know, it is safer. And now our surgeries are safe, very, very safe. It is not like before. Some say they'll just cut you open and then no, it is not like that. It is very, very safe. Exactly. It is not always like that. That was before, but now there is a great difference.
It is just done as cesarean section is done.
Exactly.
And so you don't go through any serious trouble.
Exactly.
Just that the perception is that you will not be able to
live for long.
Yeah, give birth again and all that.
Their main concern is you will not give birth again, so they wouldn't remove it.
The whole issue there, after either total removal of the fibroid, the uterus, which would include the fibroid, which is hysterectomy, is that the uterus is gone.
Yes, they think
it's gone. For that, there's no way except by divine grace where you can become pregnant, because you need a uterus to get pregnant. It is the myomectomy, that is the picking of the fibroid out of the uterus, that creates the scar tissue. And that is where the major problem is with this situation, where people find it difficult. The reason being that after the sperm cells is injected through the vagina, through the cervix into the uterus, what happens is the epithelial cells become very rough because of that scar tissue. And so the sperm cells could not be able to move on that surface, that rough surface, you know, driving themselves all the way, swimming all the way into the oviduct to get fertilization, you know, take place over there. Then in the weeks, they might be descending, the fetus must be descending to plant itself around the walls of the uterus. And that's where the problem is. Once there's a scar tissue, the sperm cells find it very difficult to swim across to the oviduct. That's where the challenge is.
Yes.
So a good gynae who takes you through surgical, by myomectomy, should be able after that also work on the scar tissues as well. So if that is done properly, we had a lot of cases where after that they pick seed and they have a safe delivery as well.
All right. So pelvic exam, does it always detect fibroid? Because we've had many cases where people, I've been to Kulebu, I've been to other hospital, I've gone through the pelvic exam scanning, and they're telling me no fibroid. Later in life, they find out that it was fibroid after all.
Yes. The problem is it depends on the sonographer that is conducting that examination. There are very bad machines that some facility uses. Yes. Sometimes you'll be surprised the most best facilities, you may go through such conditions or screening and you may not be able to detect anything like that. And so it depends, first of all, the kind of ultrasound scan machine that is being used. Then two, the sonographer that is really conducting that examination, because it needs patience to be able to conduct such an examination. But if most of the time they just take the probe and then just pass through your abdomen, and then they tell you, if you're in hurry, you cannot be able to really detect anything. And so it's a patient's work, and that comes the love of the work you do, the love of the humanity, it counts. As the person is just working, or the gynae is just working, or the sonographer is just working for fun, then of course he might not be able, or she might not be able to really detect that. So of course there are certain situations that people go through, women go through the examination and nothing is detected. But that is not the end. As much as the symptoms of what you're feeling continue, then you need to have a second, third opinion and then being able to really nail it, whether there's a fibroid or there is other gynecological condition associated.
Okay, so this is one of the problems, the challenges that we have. You know, fibroid is a growing tumor. It grows just like your bump on your face. It starts little.
How fast does it grow?
It can grow really
Very
fast.
Okay.
Really, really fast. If you are distorting the hormonal system, it can grow fast, especially if your estrogen is always going high. Yeah, it can grow fast. So it grows. It starts like a pimple.
A pimple.
Exactly. And some as being in the muscles of the womb. The probe can't just pick it easily like that. So when you go, that is why I always advise the young ones, at least every year, even if it is once a year, do try and then check.
See a gynecologist.
Yes, you see a gynecologist and then you go through the checkups, because if it is just developing, physical examination cannot, diagnose that. Yes, so you need to go through the examination, especially if you are experiencing the symptoms of this heavy bleeding, unusual menstrual cycle.
Someone, so it runs through the family. We are like that.
It is genetic. Some is genetic.
Okay.
Some is genetic. Some inherited it from their.
So fibroid is
genetic.
Genetic.
Yes, it is. It is highly genetic. So especially if you know that you have this background, then it should be your priority that you check at least every year to make sure that you are safe. And if you are not safe, then you start putting up measures to prevent it from coming. And we have lots of preventive measures that we can take to prevent it from coming, because some people will tell you, I removed it and it is growing again. Okay, so did you stop what is making it grow again? So if you remove it, they'll tell you when you went to the hospital, they told me that when they remove it, even if I remove it, it will go again. So why am I going to remove it? But the point is, if you remove it and you take very good care of yourself, you can at least prevent it
from growing again,
from regrowing.
Yeah.
Because most of the time, we wait till we are at the peak of the problem in which we are.
Yeah.
Then we go to the hospital and they tell us, don't eat this, don't eat that, don't eat this. And then we come home.
Find problem with that.
Exactly.
we enjoy our meal.
Exactly. And then we passionately say, oh, the doctor says I shouldn't eat this, don't eat it. And from the beginning, if you had done that, it would have saved you from
lots of trouble.
Exactly.
Okay, let's read these messages. This is Nanaba from Dansuman, and she says, I have a 14-year-old daughter who said I have a menses just last year, and she is going through a lot of pain. Is it a sign of fibroid? Okay, and this is also coming from Frank at Adenta, and he says that my wife once had fibroid, went through surgery, but she's not experiencing her menses anymore, even though she hasn't reached her menopause stage. Okay, let's take these two. After that, we read on.
Okay.
So Nana based on.
Yeah. Sometimes it has been researched, and we've found out that when a child experiences menses earlier, before ages 9, 10, that child is prone to developing fibroids.
Yes.
So as the child is having severe pains, heavy bleeding at age 14, just go see your gynae so that they can go through the examinations and either rule out fibroid or tell you that she's having something else than to sit and be piloting it with painkillers. That is what a lot of mothers do.
Take the paracetamol.
Exactly. And before the child grows, the pancreas is down and things like that. So we shouldn't be packing drugs into the system, trying to pilot the system. No. Take the child to see a gynae so that you can,
and
solve
to
the
add
problem.
to that, if a proper screening could be done on that child, probably, as she put it, the menses might have started very early.
Yes.
And if the menses could have started very early, then it means that the child had also led certain lifestyle, heavily living on these animal products.
Okay.
You want to talk of eggs, milk, and stuff,
So
which is liable
when you're young, you should take
to raise the estrogen levels.
Oh, okay.
Those products, of course, would cause a disbalance between the estrogen and the progesterone. And that is why fibroid is mostly a hormonal issue. That same child, if you should do conduct a mammogram on that child, you would realize that probably some lumps of the breast is also developing equally.
Yes.
If indeed it is a fibroid that is, causing the pain. And so ideally, that child must be sent to the gynae or the hospital where she could be screened properly. And so we can be able to know exactly what is causing the pain.
Exactly.
As I said, it's not only a case where always the case where there is a pain, then it means that it's fibroid.
Endometriosis can be there.
Endometriosis can also occur, cysts can be there, and all that. So there is the need, and right after that, that child must check her lifestyle in terms of things he put through the mouth to the stomach. It's very important.
All right. Is it always normal that at a younger age, a child should go through this pain of?
No, it is not normal. I had 2 daughters. We had 2 daughters. I mean, we'd never at any point in time see them starting their menstruation, but never ever gone through any form of pain. We've never experienced it before. Likewise herself, we've never experienced anything like that. That is a must that, I mean, a growing child should be able to go through those kind of conditions. No. The only time a woman during that cycle must be able to feel some pain, it is only during ovulation.
Okay.
So it means when you're having your menses doesn't mean you have to be going through
that pain.
pains.
Okay.
It comes unknowingly. Yeah, sometimes you may be at a function before you realize.
That is
it's out.
It's out.
Yeah.
Okay.
And so it's not something you got to go through suffering, pains. No, provided your lifestyle is good.
So in clarifying things, it's when you're going through your ovulation period, like your premenstrual thing, that's when you experience maybe headaches, abdominal slight pain, but not when you are flowing.
No.
Okay.
When you're flowing, you don't.
Then it's abnormal.
Then it becomes abnormal. It needs to be checked.
Okay. All right. So with Frank's question of his wife, who has undergone surgery already, but then now she's not yet at her menopause stage, but she's not flowing anymore. So can fibroid stop one from flowing?
It is not a fibroid. In her case, or Frank's case of the wife, there was a myomectomy that has been performed.
Yes, has been made on her.
Right? And so it depends. And there's a lot of situations we've ever experienced is that some, they tell you they're going to perform myomectomy on you. But before you realized, it is a hysterectomy that has been done.
So what's the difference between the two?
The hysterectomy would have to do with a total removal of the whole reproductive system.
So your uterus, everything?
Everything, the uterus, the cervix, the ovaries, everything is off. All right? In that case, it becomes very difficult for any form of conception, as I put it earlier.
Yeah.
But myomectomy is just going into the uterus and then just picking
out the fibroid.
Yes, pick out the fibroid. No matter how many that are located in there, it can be picked one after the other and leaving the uterus intact.
Okay.
And so in situations like that, in her case, there's no menses flowing.
Yeah, at all.
Of course, the hormonal system could also be tempered with.
Yeah.
Okay.
During that surgical operation, there could be some, tempering with the whole hormonal system. So that should not be a difficult work to do. By going to see his gynae or her gynae, that should be able to be solved.
All right. Okay, so you can send in your questions on our WhatsApp line 0559 680066 0559 680066 on all our social media handles. That's at Hope TVGH on Twitter, Instagram, Facebook, and YouTube. We are streaming live on Facebook and YouTube as well. Let's go for a quick break. We'll be right back.
Hello, my name is Mrs. Betty Adom, a career woman, a wife, a mother, and a servant of God who is passionate about families. Do you know that quality life is all about finding happy balance between friends, work, worship, and family? Family is very crucial when it comes to happiness. That is why I bring to you a talk show that is more involving, informing, and thought-provoking from the Christian perspective to assist 21st century families in handling issues confronting them. Join me every Friday, 8 p.m. on this channel with experts to strengthen families and to inspire hope.
Hope Channel, changing lives.
Getting hot in here with this fibroid issue. There's a whole lot going on in human, especially women, as systems that sometimes we have no idea that can create a lot of problems for us, and that is fibroid. And Dr. Penelope and her husband making a good point about how we're going to get fibroid, and if you go through that, other things that you can do to help yourself, and also other things you have to stop doing. We don't want it coming back in your system. Dr. Penelope, you were explaining something earlier.
To help Frank and the wife. You know, the system is an autonomous system. It operates on its own, and our system is just made of nutrients. Okay, so as the fibroid surgery is being conducted, there is a distortion in the hormonal system. So she's having amenorrhea. She should just go back to her gynae and then report this to her, and she'll know what to do for her. It is not a disease that she's developed, but maybe the system is halted for a while. So she should just go back, and I believe the gynae will help her.
All right.
Probably we would like to know how long has the menses ceased.
Okay.
That is another factor.
All right, so Frank, we want to know if you can get back to us how long it has been since your wife went through the surgery and now she's not flowing. We'll be happy. Doctor is here to give you the answer. This is Teresa from Kumasi, and she says that can fibroid be naturally cured?
There is
aside surgery.
Yeah, there's been a lot of speculation.
Yes.
And a lot of field research has also been conducted over the years. But largely, before any natural medium will be used to handle fibroid, it depends on the sizes and where they are located.
Okay.
But most of the time, it's quite very difficult, you know, using that medium. The main approved way of getting rid of this is the surgery.
So we don't have any other means aside.
It is there. The whole thing would have to do with, first of all, what is causing the problem. As we indicated, it's a hormonal problem. So how best do you conduct yourself to be able to normalize and then balance up the estrogen and the progesterone? Is the first point of contact. So let's say we've already said lifestyle in terms of your animal products usages and that of contraceptives usages, you know, create some of these disbalance within the hormonal system. And so if you come back to correct those bases, which are the causative factors, we want to put it that way, then you should be able to use some nutritional medicines, some herbal drugs that are there. You could be able to do something. But the certainty is still very, very thin. Most of the time would have to do with a surgery.
With a surgery. Okay, so Teresa, doctor said surgery.
Yes, and I would like to help Teresa here.
Okay.
A lot of people are doing this natural remedy.
Yes.
You know, it depends on the size. Some, as I told you, they are not problematic at all. But the huge ones, don't see that I'm going to use
the natural
remedy. It is going to take years and years to work on this thing. And if you're not careful, you will die before that time. So depending on the size, if you go today and they tell you, okay, you have a fibroid and you're not having any symptoms, then you have to watch your diet. Some use hormonal drugs, you know, hormonal medicines, you know, that is non-surgical treatment of fibroid. They use hormonal medicines, you know, to treat it. They stuff or they turn the switch of estrogen off. Good. And they stuff the fibroid to shrink. Right. Some do embolism to stuff the fibroid to shrink. Some even fast. Yes, a woman once came to our outfit, and after hearing certain things, she decided to fast for 21 days. And it fell out. I cannot do that anyway. Yes, exactly. But she closed her eye, you know, she just managed through it. And it was, I said it was a miracle. It just came out like that, and she was free. But if it is that huge, please just go in for the surgery. It is not that scary as we perceive.
The natural way, again, it would have to do with when you are in menopause. I mean, most of the time, we believe that in menopause, definitely the estrogen level declines.
Yes, totally.
And so, therefore, the possibility of it shrinking is also high.
Yeah.
But in a lot of cases, also, people are in their menopause.
They still having, because it is out of, you know, it is out of control. It is too huge. So you have to remove it.
I remember some years back there was this lady that came, is a pastor's wife, that you can see is so huge, like a 9-month-old pregnancy. And it says no. They said if she remove it, she's going to die. So, you know, we attach a lot of spiritual you know, issues to this condition. And it does kill a lot of ladies because they continue to bleed excessively, especially if it's a disturbing one. And it causes all the time anemia. And in as much as you're going through anemia and you want to be also going in for the blood tonics, eventually you also helping they are cells, they grow.
Yes, they grow.
Right?
They are feeding on.
Yeah, you're still feeding. And so definitely will continue, you know, growing.
Yes.
And it reach a point in time you can't take it anymore. The only way out is to land yourself at the theater and then take it off. It's the best way out. And as she put it, it's no more a threat going through fibroid operation. The most important thing is that the surgeon has to have time for you, especially if it is an intramural one that is so much.
Multiple, some kind of many.
32. 32.
Oh yeah, it can go as far as, I mean, one instance we had at Tema was 64. That was picked.
All in one person.
All in one person. So it just need time and patience on the part of the surgeon to be able to pick them one after the other, and then leaving the uterus intact, you know. So you can be able to go through your normal fertility cycles again.
All right. So this is Estella from Cameroon, and she says, can fibroid affect pregnancy?
Yes, it can. During the first trimesters, you know, estrogen surges, estrogen goes up. And you know, fibroid feeds on estrogen. So when it goes up like that, it helps it to grow and compete with the fetus. Baby. Exactly. They compete with space. And if it is especially the submucosal one, it is going to cause miscarriage because it pushes into the uterus. And so it will definitely, it will support the pregnancy.
All right. So what are some of the food? We know of the dairy foods and then fatty foods. Are there other foods that if we take, because I heard of white bread and then some fruits are not even good. They can also cause fibroid in our system.
Okay, the fruits can cause fibroid.
Fruits. I don't know how true it is.
Okay, I've not heard that one before.
That's what I heard.
Because we need to eat our fruits. Human beings are made to eat fruits, vegetables, the seeds and the nuts. So even if we eat the junk, my husband will always say that even if you eat the poison, you know, make sure that you add the natural so that you balance it a bit. So we need to eat our fruits, we need to eat our vegetables, we need to eat our seeds, and we need to eat our nuts. When you look at the animals, they feed on these things. They are grass, and they live normal. But you can see that our foods are complicated, and they're causing a lot of problems for us. If we can check on that, especially women. You know, we'll be in the kitchen, we'll eat all the, you know, we taste everything.
Everything.
Exactly. And then after that, we will set the table and we will sit and
we eat again.
After that, when we go out, we see the yogurt salad, we want to eat it, the buffet, we want to see the drink, we want to eat everything. At the end of the day, you see us bloat out. It doesn't help. It doesn't help. So we need to know what to eat and what not to eat. Pear is very good for the womb. Have you seen the shape of pear?
The shape of a pear.
That is, if you've not seen the womb before, that is how the womb looks like pear. Okay. And the nutrients in there helps the uterus.
Okay.
Very good for the uterus. So it's pear. The cholesterol in there, it's natural. We shouldn't let anyone deceive us that when we eat pear, we will develop cholesterol, and so we will not eat it. It is deception.
The problem with the African is that you still have to go in for the typical African meals.
Yes.
Which should have to do with these
the
carbohydrates, protein combination.
Yes.
If you don't have that, then it means you've not yet
eaten well.
Good.
Yes.
But then there is a need for us depending on a lot of the fruits and the vegetables. And when we are asking you to eat the fruits, we're not talking that just get one orange and then just stick. No. We want you to eat the fruit as a meal. And we have the acidic fruits over there and then the alkaline fruits. You need to not combine them, or you have to separate them. For instance, you can have your mango, pawpaw, banana combined as a fruit, as a meal. So you're going to eat that fruit as a meal.
A meal on its own.
And that is a non-acidic fruits.
Okay.
And then you want to combine both the oranges and the apples and then the grapes and then the pineapples. They are also acidic. You can combine them, have enough of them to eat as a meal. The problem would have to do with, you know, taking a little of the fruits, not eating it as a meal, but as a dessert.
As a dessert.
Yes, that's where the problem is. And when it comes to the vegetable family also, you have to eat enough. These are some of the basic remedies you can, or preventive measures, if you have not yet developed this condition. As a young girl coming up, these are some of the things you have to develop the interest in and then be doing. Other than that, if you are predisposed to it genetically, then of course, once you are on the path of the excessive meat intake, excessive of the eggs, the milk, and those stuffs, and at the same time trying to prevent conception, probably you don't want to pursue holiness, and you want to dash down there and then come in for these contraceptives. And of course, you're going to pose a lot of problems to yourself.
So there's one way or the other a way to prevent fibroids.
Exactly.
All right. So we had Dr. Mrs. Penelope Ham and her husband that see the contraceptives you take in. Be very careful and what you eat. And all right, Doc. Before you leave, we want to acknowledge your hospital. You made mention that there is one at Amasaman, there's one at Malam, and there's one at Tema. Please, the name again, and then your number, in case somebody wants to get to you.
We have 3 facilities running in Accra and that of Tema. Yeah, we have. We are located at Tema, close to Community 1 Post Office. And Medicine Clinic. And then we're also located at the main Stadium Road of Amasaman. Yeah, we located there, and also Malam, on the main Malam Road. We located there. And God is using us to do a wonderful thing in the life of a lot of people.
We thank God.
And so it's an opportunity to get in touch. So we do business.
Yes. So your number will be very relevant.
Right. My number is 0244.
Okay, 0244.
56. 57.
Okay.
And 17.
All right.
And hers is 0243.
Okay.
420. 869.
Yeah.
I hope I'm right.
You're right.
Please repeat.
024.
Okay.
3.
420. 869.
Yeah.
And mine is 0244 56 57 17.
Okay. So if you want to locate Dr. Penelope or her husband, Mr. Francis Ham, sorry,
John.
Dr. John Ham, then you can locate them at Amasaman, Malam or Tema. Or their contacts will also be given out again to you if you want to call them on phone.
The Amasaman, the Stadium Road branch, is mainly manned by my wife.
Okay.
That's where she does a lot of the gynae work.
The gynae work.
Yes, and she's there most of the time.
All right.
But I run both the malam and then the term.
Okay.
So she is always at our
Okay, so it's
if you have a serious gynae problem,
you can see. All right, Dr. Penelope. So if you have a gynae problem, you see Dr. Penelope. She's ready to help you out with any issue pertaining to your womb, uterus, cervix, everything. And also thanks to Valley Life Mineral Water. It's located at Valley View University. For bulk purchases, you can just go there and they're ready to supply you with good, clean, healthy water. Not just any water, good, clean, healthy water. A big thanks goes to you, my viewer. You always make time to watch Healthy Living. If you're not there, we are not there. And most importantly, your health matters to us. That's why we're always ready to help and coach you to make the right choices when it comes to living healthy. My name is Nana Akusiabuachi. Thanks to my crew who always back me up to make this show a reality one. God bless you and bless everyone, your family. Stay healthy. Meet you same time next week. Bye.